My name is Vicki Kalitzi, and I'm going to be your host for this evening. I would like to introduce Dr. Turner. Dr. Turner is an assistant professor in the Department of Clinical Research and Leadership with a secondary appointment in the Department of Neurology at the George Washington University School of Medicine and Health Sciences. He earned a PhD in sociology at the Graduate Center, City University of New York. He holds a position as a research scientist in the Center for Biobehavioral Health Disparities Research at Duke University. He is a biobehavioral health disparities researcher with ethnographic and mixed methods training. He is the principal investigator for a National Institute of Aging Health Disparities Award to conduct multi-method research that assesses caregiver burden by exploring whether the stress of being the primary caregiver of a person with dementia produces cognitive dysfunction. His current National Institute of Aging funded KO1 award examines psychosocial and neurocognitive research in protective factors, accelerated cognitive aging, and mild traumatic brain injury among former NCAA Division I and former NFL athletes. This line of research encompasses understanding how traumatic injury as an occupational hazard hinders daily living and career planning over the life course. He is also the author of Not for Long, The Life and Career of the NFL Athlete, and a contributor on the LeBron James HBO documentary, Student Athlete. His experience as an NFL player, San Francisco 49ers, and as researcher provides an insightful perspective on the various factors that contribute to Black male health disparities. So without further ado, I would like to introduce Dr. Turner.
Well, thank you. Thank you very much. I really appreciate that. And if anything, all of that is really just about the fact that I care about Black males' brain health in particular. And there's lots of different reasons, and we can talk about that today. But one of the things that's really important is when we talk about Black males, Black men, and I talk about it across the life course, is equally important for Black men's brain health are their relationship to Black women. And so that's really kind of one of the things that I want to make sure that we emphasize through our conversation today. And I hope that we can kind of share some things. I hope that I can answer a lot of questions. Maybe everyone has seen the video that we did earlier, but I want to talk about caregiving from both a micro level and how it affects the individual, but also particularly for us on what we call the meso level, both in the family, both caregiving around dementia or other, neurocognitive, neurodegenerative diseases, brain injury, because this is one of those things where we are today and where we're going to be heading as a community. We need to start thinking about, just like when we use the term, it takes a village to raise a child. It's going to take a village to look after our older adults around these kind of cognitive kind of issues. And it's a wave that's coming for a lot of reasons that we'll talk about. And I personally have seen that within our communities, we're going to have to provide our own solutions, and we're going to need each other doing that. And so I'm hoping that we can talk about caregiving from the individual person in their own homes with their family, but then collectively, what does caregiving mean to our community?
Thank you. So I believe tonight we were going to show the video, and then after watching your video, then we will open it up for question and answers. Okay.
Wonderful.
Thank you.
Good evening and welcome to Dementia Friendly America, Prince George's County, Mid County Caregiver Conversation. I am Jenny Lee, Mid County team member and co-host with my fellow Mid County team member, Ms. Irma Nicholson, who is also a longtime caregiver. It is an honor and a pleasure to introduce our guest, Dr. Robert W. Turner II, PhD, to discuss his research study entitled The Black Male Caregiver Burden Study. Dr. Turner is an assistant professor in the Department of Clinical Research and Leadership with a secondary appointment in the Department of Neurology at the George Washington University School of Medicine and Health Sciences. He earned his PhD in sociology at the Graduate Center, City University of New York. He also holds a position as a research scientist in the Center for Bio-Behavioral Health Disparities Research at Duke University. He is the principal investigator for a National Institute on Aging Health Disparities Award to conduct multi-method research that assess caregiver burden by exploring whether the stress of being the primary caregiver of a person with dementia produces cognitive dysfunction in adult and older adult Black American men. He is also the author of Not for Long, The Life and Career of the NFL Athlete, and a contributor on the LeBron James documentary, Student Athlete. His experience as a former professional NFL player for the San Francisco 49ers and as a researcher provides an insightful perspective on the various factors that contribute to Black male health disparities. According to a recent report from the Alzheimer's Association, the number of Americans living with Alzheimer's is growing and is expected to continue to grow as the population ages. As those numbers increase, so will the need for caregivers, and so often they tend to be family members. We recognize the impact that Alzheimer's and other forms of dementia have not only on the individual, but the entire family, and in particular, the primary caregiver. Dr. Turner, can you share some data that provides us with a snapshot of who are the individuals living with Alzheimer's and or other dementias, and who are their caregivers, and are there any differences along racial lines? Dr. Turner.
Well, first of all, thank you so much for allowing me to be here and to share a little bit from my experience, from my research, and from the literature that we know. This is a very important question to me, and I'll share a little bit why a little bit later. But, you know, I'm really glad that you asked that question about what we do know. And a couple of things that I'll just share with you, but one is that Black Americans may have a greater likelihood of experience Alzheimer's disease compared to non-Hispanic white population. And I'll explain that in a little bit later why. But as much as 90% of care for mentally or physically impaired adults is provided informally. So we're not talking about, you know, care coming from the state or from nursing homes, but we're talking about in people's homes, but through loved one, as much as 90%, which is a lot. And anywhere between 30 and 40% of what we call informal caregivers are by elderly husbands, often caring for their spouses experiencing dementia. Right. And so think about that for a moment. And that's within the Black community. And so, you know, previous research has shown that Black American men often feel underprepared as caregivers. And we're talking about 30–40% of all informal care given by husbands to their wives, but they don't feel like they're prepared for that. They're also disinclined to discuss that role with other people. So in other words, maybe they're afraid of the stigma, or that they don't know how to explain, but they don't really talk about that to other people. And Black men also rely on informal support or
types of resources due to hesitation or unawareness. So they're not reaching out to their doctors. They're not reaching out to pastors at church. They're not reaching out to their social network. They're not reaching out to the Alzheimer's Association. So that's really kind of one of the things that's really important here. And then also the body of research that focuses on Black American men as primary caregivers of a person with dementia is really sparse. But then there's some other things that we really want to kind of focus on. That basically Black caregivers with greater experience, education, both Black men and Black women, or those who are younger persons, they generally experience what they consider caregiver stress or burden at a much higher rate than those with fewer siblings. So there's a number of different things that are really important about Black caregiving, about dementia, about what's going on in our community that is really important that we've learned, is mainly because we're not talking about what's going on with this. And so that's really what drives a lot of what I'm thinking about in trying to do the work that I do.
That is very enlightening. And some of the statistics are very stark that you provided with us. Now, Dr. Turner, as you begin telling us about the important work of your study, I would like to ask, kind of, you've already discussed it a little bit, but what was the main impetus for you wanting to do this study about Black male caregivers?
Well, again, that's a really good question. And it was kind of not nearly as straightforward as one might think that it would be. I started off when I was in graduate school. As you mentioned earlier, I played professional football. And so one of my professors in school said, you know, the best way to do the research that you're really inclined to do is study what you know. And as you mentioned, I was a former professional football player, and I struggled with my transition to life after football. And so I really wanted to better understand that. And I noticed during that time, something that was very interesting that started to pop up. And that was just at the time that the concussion, you know, we were hearing about concussions all over the news, the Will Smith movie, Junior Seau committing suicide, all of those kinds of things. And we started noticing that it was happening much more to Black men. So that was one of the things that really started in my mind, what's going on here? But then some of the men that I was interviewing were talking about their personal experiences. And what I learned is that there are a great deal of Black men in our community that are suffering from mental health issues, depression issues, stress issues, all of those kinds of things. And so that's what really started getting me around this, thinking about, first, it was just kind of focusing on mental health issues. And then I realized that, you know, we started to talk about concussions because 70% of the NFL is Black. A lot of Black men play Division I college football, which is that's the feeder position into the NFL. So I realized that brain injury, some stress, mental health issues, what we call brain health, it really impacts our community in ways that's maybe different from a lot of other areas. But then what really got me starting to think about caregiving is because my dad has dementia. And I've watched it since the years I've been out of graduate school. I've watched it go from early onset to really much more progressive state of Alzheimer's disease. And I saw the actual issues that my mom was going through in terms of being a caregiver. And I saw the stress and involved with that. Then I was doing a little bit of reading, and I realized that I said, well, what about men who actually provide care for women? How personally prepared are they? Because as you well know, Black men have amongst the worst health outcomes of all demographic, racial and ethnic demographics in America, believe it or not. And so I thought, well, if providing care is that stressful and is that difficult, and people don't talk about it that much, what does that mean to Black men's health? And so I started digging into the literature, just like I was trained to do as a researcher, talking to medical doctors. And what I learned was we virtually know nothing about that. And so if we have comorbid outcomes with our health, and then we are also at greater risk of stress and all of these other things, is it possible that this could be affecting us in a worse way than we actually know? And I thought this deserves the respect that we need to have in order to find out, how do we care for this vulnerable group within our population? That was really what started the study for me.
Thank you, Dr. Turner. And now we want to hear more in detail about your study.
Okay, great. So how I started to think about this, I first read about a study, as I mentioned to you before. I was digging into the research and trying to find out, like, a good scholar is supposed to be, what do we know? And I found we knew very little, but what we did know about almost everything that we know about caregiving is generally from women who are providing care for men or for other loved ones when it comes to dementia, cognitive impairment, and those kinds of things. So there was a study that was done in Portland, Oregon, and there was a couple of things that stood out to me that was a little strange with this study, but I understood where they were coming from. They were reporting about both the psychological as well as the physiological stress that caregivers were undergoing and they call it caregiver burden. And so I thought that in and of itself was a really interesting term, because I've never heard of an African-American Black person ever use the term burden when it comes to taking care of one another. So I thought, okay, well, what does that mean for our community, number one? But number two, when I looked at the population that they had studied, and they did find that there was physiological stress, emotional stress, chronic stress, it was very much, and that's why they were using this term burden. But when I looked at the population, they didn't give a racial breakdown of the population, but what they did give is a gender breakdown. And it was 75% of the participants in that study were females. And I thought, well, okay, so what about the men? And then the other thing that they showed in there that they didn't really share was the racial composition of the population that they did research on. So then I went and did a little bit more digging, and I thought, okay, well, what is the racial composition of Portland, Oregon? And what I found out is that essentially there's only about 10%, less than 10%, it's about 5% Black people that live there. So I thought, well, basically this study can't tell us anything about Black people, Black men or Black women, and they certainly can't tell us about how Black men, if they provide care. And I thought, well, what does that mean for us here in the DMV, where we have one of the largest Black populations in the country? How many caregivers are there, and what do we know, and how do we have to get to that? So for me, what I did was, it draws on what's called the NIA, the National Institute of Aging Health Disparities Research Framework. And this research, it's a project that seeks to comprehensively identify what we say is social cultural. We really want to understand the cultural aspects of this, as well as the biobehavioral factors that affect brain health and well-being of Black men who are providing care for a loved one. And for us, the definition of providing care is someone who's providing care they're not being paid for, and they're at least providing care for 10 hours a week for someone that they love. And so by that definition, that would be myself, because my mom and dad live in New Jersey, and I go there once a week, and I spend quite a bit of time giving my mom some time off so that way I can spend the time with my dad. And so I started to realize, wow, what I really wanted to study and what I really understood was the experiences that I was going through. So our study basically has a couple of aims. And the first one is to examine which aspects of, kind of the cognitive performance, or in this instance, your brain health, your cognition, your memory, all of these different things. What part of it is affected by being a caregiver, and the stress that may come along with it. And anyone who's provided, as much as you love your person that you're taking care of, you know that it's stressful sometimes. Sometimes you don't sleep, sometimes you don't eat properly, your schedule gets off. So I wanted to understand, how does that stress affect your cognitive performance, your memory, and those type of things. And then the second thing was, we wanted to investigate which stress-related physiological, or that means the physical things that happen to you, or self-rated like psychological things, how do they kind of affect your cognitive performance, and what does that mean to be a caregiver? And so again, what we do is we collect, it's to provide approved data, to collect survey data, and then clinician reported assessments. We do semi-structured interviews here. We do saliva collection. for cortisol levels. Cortisol levels will allow you to know what kind of stress that you're under, if you have high stress or low stress. And then we also do what's a full battery of neurocognitive assessments. And so we initially were planning to come out into the field and to meet people either at, say, for instance, adult daycare centers or anything else like that. But because of Corona, we were not able to be able to do that. So our study now allows us to meet individuals and speak with them on the phone to collect the data, or to be able to meet with them on video like we're doing right here. And we can do the whole process. It takes about 3 parts. The first one is a screening part, just to make sure people are eligible. Then the second part is to do the semi-structured interviews, to take the whole health assessment, and then to do the neurocognitive assessments. And then the third part is we send a saliva kit to your home directly. And we have 2 different small vials in it. And we ask you at 2 times in a day, both right before you go to bed and the first time you wake up in the morning, for 2 days in a row. You put it in your freezer, and then we come and physically come and pick it up from you, making sure that we have the appropriate social distance, the masks and the gloves and everything else. So that way we protect everybody that's involved. And then we take it over to Children's National and we start to analyze that data there. So that's the kind of the overall general thing that we do. And the people that we're looking for, and we've been very, very fortunate with community organizations like yourself saying we understand the importance of the study, and they've allowed us to be able to, send social media messages out, flyers. We do talks into the community, of course, virtually. We do question and answer. We provide a lot of information from the Alzheimer's Association, which is one of our partners. Our grant is funded through the National Institute of Aging, so that we want people to feel very, very comfortable that this is research done in the community, for the community, by the community. The other thing that we thought was very, very important, so we're not taking any money from pharmaceutical companies or any kinds of organizations that have a particular political agenda. This whole thing is only funded by the National Institute on Aging. And the other thing that we shared, and we thought that it was very important, and we've heard feedback from people who are in the community, is that we worked really hard, and we told them, we said, listen, if we are going to ask people to give up their time and their energy, especially those people who are providing care, if we're going to ask them to do that, we need to have some kind of way to compensate them for their time. And so I believe that we are able to pay up to about $100 for people who are involved, getting involved with them. We didn't want to just take from the community. We wanted to make sure that we pay people for their time. We also want to make sure that we are a valuable resource. We have doctors on our staff. We have clinicians on our staff. We have people that can provide all kinds of support for people who have questions. They can call my research lab. They can email us, and we have people available. I'm also the director for what we call, there's a Institute for Brain Health and Dementia. And so I'm the director of the community-based part of the organization, and we reach out and make sure that we have a lot of resources that we're able to give back into the community. So the other thing I just wanted to also share kind of about the study that's really important for us, who we are, we're focusing on recruiting 80 Black men for this study. 40 of those men are men who do not provide care, and then 40 of the men are for men who do provide care. So, because what we want to be able to do is we use the men who do not provide care. They're the ones that we call, in parlance for science, they're called the control group. Or in other words, they're the ones that are not exposed to the stress of providing care. They may have other levels of stress, but they're not providing care. And so we're just measuring what is overall the level of stress among Black men in the DMV area. And then we're also looking for the other group of 40 men that are in the study, or that are providing care. And so we collect the data from both of those men, and then we analyze the data and to see, are there different levels of stress or different types of stress, or, as we mentioned before, cognitively or physically, physiologically, do we see different levels of outcomes between the two? It could be just the fact that, you know what, being Black man in America, or at least in this area, there's so much stress involved with that, is that they both groups look very similar to one another, or it could be on certain types of cognitive outcomes or performance. It could be higher stress levels and produce lower levels of cognitive functioning or performance in certain areas. But the real important part of this study is that we just really don't know. And that's why we're asking people to get involved. And I think the other thing that I want to just share with your group that's really overall very important, what we found is one of the reasons, because people come to us all the time and say, well, why are there so few Black men in research that have been involved with biomedical research? And what we've learned very, significantly is many of the men that we've asked, have you ever been asked to be involved in a research project before? And they've all, to the T, most of them have said no, they've never asked. They said, but if we were asked, we would be much more inclined to get involved. And so what that shows us is that generally people who have done this kind of research before haven't been from these kinds of communities. They're not part of our community. They don't know how to ask. They never thought to ask. They've never actually gone out and said, okay, what's going on with this group? And what I feel, and what the literature shown, what the people that we've been working with have shown, is that Black men and Black women collectively have said, you know what, we care about our health. We care about the health in our community. We want to provide ways to be part of the solutions. But, we can never just wait for other people to come in our community and start doing this work. And so that's why I'm really here and glad for this opportunity to talk, to share, to be a resource, and to provide this information back to the community, because our hope is we can understand what the burden areas are, what the stress is like, and then we can say, okay, here are the interventions. We can work with churches, we can work with, nonprofit organizations, we can work with community centers, community resources, and say, here are the resources that are needed for the interventions that are needed to help people. But if we don't know what they are, we can never ask for them. We can never say that this is where the community is vulnerable. And so this is why we are really spending the time that we have in order to try to collect this data. So people have asked, well, where are you now? How much information have you gained so far? How many more people do you need in the study? And we're about halfway through. I say that I'm very excited, even during COVID, how difficult it has been to get people and reach out and actually touch them and get them involved. We've still, every time we give talks, every time I've been fortunate enough to be invited on the radio or on television, the awareness seems to be growing. People seem to really, when they hear about the study, they are very enthusiastic and registering. And so I would just ask, we need to collect about 20 more men who are not caregivers, and we need about 20 more men who are caregivers in order to round out the 80 men that we need altogether. So we're about halfway through, and I'd be really excited to answer any questions or whatever it takes to get people involved so that we can be better equipped in order to, what I would say, support the people who are most in the need when there are times that they're vulnerable and they need support, because the best support is always going to come from within the community.
Dr. Turner, when you talked about the time involved, and you said that there were 3 parts to it, yes. I believe. So what's the total time commitment then that the participant would have to do?
In total, I would think the amount of time, the first initial screening, that only takes about 10, 15 minutes. And then the largest part of the study is going to take about an hour to an hour and a half, depending on how long people answer the questions. So it's really about your own health profile. And then we do the neurocognitive assessments. And then, so that's the longest part. Again, like I say, an hour and a half. And then the last part is when we do the saliva collections. You do that on your own at home. So when we mail in express mail, we send the tubes to you. Again, it takes about a minute to a minute and a half to put it in the vial. You do that twice a day, once before you go to bed, the next time you wake up in the morning, and then you do it, repeat it the second day. So altogether, depending on how long it takes someone to really kind of give us their health profile and history, it takes, I would say, about 2 hours at the most if we do it efficiently. The other thing that I do want to mention to you is that this is an anonymous study. So we do not collect any of your personal information that's matched with the data that we collect. We obviously collect your name and your phone number and your address and email address, so that way we can schedule a time for you to do the, the data criteria and do the information. And then we send the information out to you with the saliva kits. But once we perhaps collect your data, we never match your data with your personal information. So I could never tell you who number 105 is. I could tell you who we called and spoke on the phone, who we sent your stipend to for participation, but I could never tell you personally, your saliva reads this way or your health profile is this, because we thought that it was very important for it to be anonymous. And we just want to be able to have the data to report back to people.
I'm so glad you mentioned that, because that was one of the questions I was going to ask you about the confidentiality. And I know, especially in the Black community, sometimes there is a mistrust. And so thank you so much for answering that. I basically have just one more question. When you talked about the number of participants that you had and that you were halfway through, do you have a time frame for how long did you have to do the study?
Yes, so we are hoping, fortunately, because of NIA has been so very supportive of this, and we've received a lot of great support from the Alzheimer's Association as well, because they've shown us many times that this is something that they need to know. They don't have the information and they really want to have this. So we're hoping to be finished in the field and collect all of our data by, say, August. At the latest, we're hoping that we'll have this done. And then here's the exciting part, is that they've shown a real interest, because we've done this as a pilot study. It's only in the DMV right now, but what we're hoping to do is, once we compile everything, and one of the things that was very, very important to them, as I mentioned to you before, the number of studies that focus exclusively on Black men on any kind of biomedical health examination is really sparse. And one of the things that people have, in NIH and other, biomedical researchers, they consistently say, well, it's impossible to get Black men into research studies. That's why no one's ever done it before. Well, we're showing them through our work that it is possible. We're showing them that if you get to build relationships in the community and you ask questions that are important to the community, that the community will support this research, not because it needs to be at NIH, but because this is information that we need in our own community. And that's the premise that I'm really working from, is what does it take to design research that's necessary and important for the community, to give back to the community, so we can do this work together. So as we prove that it is possible to get this together, what we hope to do, as I mentioned to you before, we just started this as a proof of concept pilot study for Black men. But what we hope to do is next is to apply for another round of funding, and then we will then look for Black men and Black women in the community together. And we're obviously keeping the data, looking in different gender and seeing what the outcomes are. But then we also want to do this on a national level. So my hope is that we can prove here in the DMV area that this can be done, and then we can then take this on a national level and find out, are there regional differences? Do people have differences down in the South compared to up in the Northeast, compared to the West or other areas? Because again, as a community, we may be Black, we may be African American, but we're all not the same. There are differences, and we can't just act like all of a sudden, just because we collected this data, we know all there is about Black male caregiving in our community. So there's a lot of work to be done, but I'm grateful that the work is starting here in the DMV area, because I've seen that there are a lot of great people who want to see this work succeed.
This is just wonderful, wonderful information that we greatly need in our community. And now I'm going to turn it over to my co-host, Ms. Irma Nicholson, who is a longtime caregiver, and she has a few questions for you as well, Dr. Turner.
Certainly.
Good afternoon, Dr. Turner. My name is Irma Nicholson. I'm a caregiver and an advocate for my husband of 14 years. I'm a member of Dementia Friendly America of Prince George's County, and I am an Alzheimer's volunteer. And my question that I wanted to ask, and you went over partly in your presentation is oftentimes it appears that there's a hesitancy or stigma associated with African American participating in research or clinical trials. I want to know, what can we do to help our community here in the DMV to get past this?
Well, for one, let me say, because I've seen my mom provide care and I've gone through it and I'm doing it right now, I literally will say thank you so very much. Take my hat off to you. Not only have you provided care, but you're advocating out in the community. And I think that that's really one of the main things that needs to be done is we just need to destigmatize this. One of the things that I wanted to share with people in answer to your question is, as I mentioned to you starting off, is that the number of people from the Black community that may have Alzheimer's disease, dementia, or cognitive impairment, it may actually be, those numbers may be low, underestimated, simply because, again, we haven't had enough touch points within the community. So the burden may be even bigger for us than it is in any place else, which is why this is so very important. So I would say a couple of things that really need to be able to happen when it comes to getting more people into research, biomedical research. The number one thing, as I alluded to before, is we literally just have to start asking people. We have to say, have you ever done this? Would you do this? What is your hesitancy? If we can demystify it, destigmatize it, then people will be much more inclined to say, okay, yeah, well, maybe. Or the other parts is people might say, well, listen, okay, I don't trust. Well, there's lots of valid reasons not to trust because of history, right? But what we've also learned is that the more that people are involved, the more that there's accountability built into the system, right? And so one of the things that I could tell people as well is one of the ways that if you want to make sure, let's say, for instance, in your church or in your community center, nonprofit organization, you say, okay, we're very much interested in having, as a collective group, get involved with research. But one, before we agree as a group, we have an advisory community board, right? And so we want you to come in and we want you, through our advisory board, share with us everything. Tell us about the consent form. Tell us about how you protect data. Tell us about how you protect identity. Make them answer all of the tough questions, so that way, before you ever even go out and endorse something, you can say, okay, I have accurately vetted them, and to the standards that we have an advisory community board, they pass our mustard. So before we stamp our approval on it, we know that they are who they say they are. That's one of the most important things that you could do.
Okay, thank you for that answer. And as I said, that I'm a caregiver and an advocate, I know that through being a caregiver and an advocate, we get our word out through, we have our support groups and through various Black churches, which like for the Alzheimer's, we have Purpose Sunday, Black churches, they help with doing the supporting of our Alzheimer's walk. So I wanted to know, like, what is being done in respect to your study and getting the word out and making our community more aware of your study and how important it is. And the other part is, and how can we in the community assist you in making this study, which is a very powerful and important study about the Black male study. How can we get it out? I know that, like I say, in our community with Alzheimer's and Dementia Friendly America, if it wasn't for being, say, with a support group and hearing about your study, probably there's so many people out here in the DMV is not aware. And I'm just like Black churches, and I'm sure that you have tapped into it because I have heard your presentation, but it's just like, it's so powerful. And there's so many Black men that I know within our church that are dealing with their spouses who have Alzheimer's. And how can we get the word out so that everybody would know about your study in the area?
Well, I think a couple things. One, I wish I could replicate myself, maybe clone myself 3, 4, 5 times, so that way I could be out there in the community actually meeting people. But we've done everything. I mean, we have really literally gone out to metro stations and handed out postcards and said, would you please get involved with the study, and then actually talk to people. I think so. That's one of the important things. We're looking for every opportunity that we can to be in the community. And let me just say this. From my personal goal in running this study as the principal investigator, I'm not out here asking people to get involved in someone else's study. I'm actually asking people to get involved in a study that I can vouch for. I designed it. I'm the person who's involved with making sure that this study has the integrity that it needs and everything involved with that.
Thank you, Dr. Turner. And the other part, do you have any advice or useful tools, resources for Black male caregivers or any caregivers that would help in our journey with Alzheimer's?
Sure. I would say this first. Let me direct people, and I'm sure that I'm sure that you will have this information, but I'll give you the information to my lab. It's called RW Turner, TURNERLAB.com, rwturnerlab.com. You can go on there. You'll see current research projects. So you'll see the Black Male Caregiver Burden Study. You can also reach out through, there you are. You have that information. You have my email address that people can reach out. We partner with the Alzheimer's Association. The first thing that I would tell anyone, if you really need a one-stop area in order to get all the information that you need, go to the Alzheimer's Association website. Reach out to me. I'll be more than happy to do that. And then we also are available where I can, speak to any church groups or anything else like that. And then I would just say this, or community groups, all, the mosques, any areas where we are, I'm willing to show up and be. But the other thing that I would suggest that I think is most important, if a person has been diagnosed with Alzheimer's disease or any other form of cognitive impairment or, dementia type of disease, look for a support group for that person. So
Yes.
they can start to ask people, because it's overwhelming and daunting. What is happening to me? Is this normal loss, or is it like, why can't I remember things? All of these kinds of things. Get into a support group, both for the person that has been diagnosed, but then I would also very, very much strongly encourage people, if you are a caregiver, recognize that we have our own limitations and that you need support, that you're going to need somebody to go talk to. So make sure, in this instance, information and support is key. Make sure that you have your doctor's number on hand. Make sure that you have support groups involved. And then also, don't be afraid to ask for help. Don't be afraid to talk to people about what's going on. And then I would also say, I think the last thing that I would really want to encourage people to understand with this is that, truthfully, you're not alone. That you don't have to go through this by yourself. It can be completely overwhelming, but there are resources. In the DMV area, we're very fortunate. There are a lot of community-based organizations that will be out there, that they'll give you information, phone numbers to pick up and call. Don't try to go through this journey alone, because it's really, really overwhelming, but there are plenty of people here that will help support you through this.
Thank you, Dr. Turner. That was great advice. And I'm sure that maybe you've seen a person walk behind me during our presentation, and that was my husband. So, that's a part of being a caregiver. Never know what you might have. So I thank you very much. And that advice that you have given about being involved with a group, the support group, and knowing that you're not alone, that is absolutely awesome, because I tell you, I am a part of 2 support groups, and I tell you, it is the best thing in terms of helping me to be able to cope with my husband for 14 years. So I thank you for your information, and I'm sure that our community is going to be greatly appreciative to the information that you have given us.
Well, thank you. And I would just say, I'm excited about the relationship that we are building. I'm here, GW, as I mentioned before, we have a Dementia Institute for Brain Health and Dementia Research. We have clinicians of all different types. We have gerontologists, we have cardiologists, we have neuropsychologists. All of these people are available. We can come, we can do talks, we can do a question and answer, we can do a panel discussion. We can do lots of things to be resources because, fortunately, these resources are here. I'm doing work in the community, and I thought, in order for us to be in the community, in order to answer the questions that you need, we have to be committed to the community full time. And so that's what I've really been, my colleagues at the university, I'm saying we need to reach out and be more involved into the community. And that's what I'm hoping this can really lead to.
Thank you, Dr. Turner. I'm going to turn it back over to my co-host, Jenny Lee.
Dr. Turner, I can only echo my co-host, Ms. Irma Nicholson's words. It was a powerful presentation, and just thank you so much for joining us. And on behalf of Dementia Friendly America, Prince George's Mid County team, thank you again for providing us such valuable information on your study and the need for more Blacks to take part in this study. And I think if more people saw this and heard you,
yes,
they would truly know that they're not alone in this and that there is a lot of support. And it truly takes a village, as Ms. Irma can tell you that it does, in order to be on this journey in the caregiving of a person with Alzheimer's or other dementia. So I just want to thank you again. It was just wonderful information. And thank you so much for your time and for joining us.
It was my pleasure. Thank you again. And I look forward to the next time we have an opportunity to spend some time together.
Dr. Turner, I have 2 pages of notes here. That was a very, very good information. One question I do have for you is, where are you today in reaching your goal of 80 men?
We probably only picked up about, I say 5 men from the last time that we spoke in there. So we're still very much in the field. We're out every day. My assistants in my lab are sending out everything, emails. We're making videos. I don't know if any of you have seen the video testimonies of some of the people that have been involved with this study. So we're very actively engaged and could use all the help we could possibly get.
We'll see how we can lend you a helping hand, because one of the things you said was, it's research for us, by us, right? And I think that brings comfort to others, knowing that it's someone from our community. It's something that will benefit our community. So we'll see what we can do to get that word out for you.
And thank you. Can I just speak to that one quickly? Because I did I mentioned about the community advisory board and all these other things. And I think, I know I've said it, but I'm going to try to maybe emphasize it a little bit more. I really think that working with the Alzheimer's Association, working with the National Institute of Aging, I think that if we work as a collective, and I think the last time we were together, I might have mentioned this, there's a lot more power if we work together, especially as Blacks, because Dr. Carl Hill, who is in charge of the diversity, equity, and inclusion portion of the Alzheimer's Association, last week we were in Los Angeles for Black Men's Brain Health Conference that I put on. And he spoke and he said, less than 5% of the participants in Alzheimer's research are Black. Right, which means that everything, almost all the statistics that you hear about Black people or about Alzheimer's, not Black people, but Alzheimer's, it almost doesn't pertain to us because we're not involved in the studies. So if you think about it from a very pragmatic way, if you had a group that had, let's say you represented 50, 100 people who said, yes, we're interested and we will participate in research, but it's the kind of research that impacts our country, our community. It's the kind of questions that we are really interested in. We want to work with you as a partner to make sure that we can get the funding and make sure that we can provide the resources. If you came collectively with that many people, that would be almost one of the largest studies on African-American Blacks and Alzheimer's disease that there is, because we just haven't had that kind of group of people together. So you really have a way to impact what we know about the community if we mobilize and work together.
That is very true. Are there other organizations within Prince George's County that you've partnered with?
I haven't up to this point. Again, my real limitation is that, I can't get out in the wheels and go out and see people. It's all been basically, I have 2 or 3 assistants that are in my lab, and we're reaching out. I think that's how we got involved with you in the first place. And so we recognize it takes time to build relationships, and so we got to do all that groundwork. And we really haven't reached out as far as we'd like to, but we know that we're getting. Uh-oh, I think you're on mute.
Probably because I was about to mention Shonda's name. I think she muted me. I was going to say, if you know Shonda Bellamy, then that's a good way here, to get into the county to really get the word out about what you're doing. I own a home care agency, and I have over 100 clients. All of them are African American, but probably 80% of them are women caring for their husbands. And the small group of men that we do have that are taking care of their wives, there's no formal help in the home, and the men are just so overwhelmed because in their positions, men are more protective and not as nurturing as women just by nature. And I'll say that to say there's a question that came in that said, do you have a position on male caregivers being more nurturing versus more protective in their caregiving approach?
Well, I think from my experience, what I've met people out in who have been involved in our study, it's really interesting because what I have found is that the men, again, we don't use words like caregiver. We don't use words like burden. We think about how do we honor our parents, right? At least when I was raised, in going to church, you honor your mother and your father, right? In these different ways. So I think men are very nurturing, but I think that they're not very expressive. I think that they don't use the same kind of language that women use oftentimes. But when you spend some time with them, I mean, I know a couple of brothers that literally, they live in Washington, D.C. Their mom is down in North Carolina, several of them, and they drive. They're literally every week they're on the road. They're spending time with them. So I think the language that we use is different, but I think the commitment is very much the same.
Different love language, right?
Yeah, exactly. Exactly. And I also, let me just say this as well. One of the things I think, how do we overcome the stigma for men, right? Mm-hmm. Men, when they do open up and they talk to one another, they've come to find out like, oh, I'm going through the same thing you're going through, right? So one of the things that I think is the big challenge that people say, well, how do we get more men involved? First of all, women are the key to getting men involved with research. That's number one. But number two, when men, and I think some men are doing this, but they are starting to learn how to tell each other, I love you. And when you're able to say that, and you can break that down, that vulnerability, you can almost get them to talk about anything, right? And then they can start to share like, oh man, I need help doing this, or I'm okay with that. So I think we gotta, I remember my grandfather was sitting in the corner of the room and never say anything. My dad's opened up a little bit more. That means I have to open up a whole lot more. So I think this is that village approach, holding each other accountable, telling them, I care about your health. Talk to me. How you doing? How can we help one another? This is what I'm seeing starting to be a movement in our community.
Do you think men respond to that word help? Especially with men being especially that older generation, they were the ones who kind of took care of the family and really never asked for help, right? I've never heard my father say, help me, or I need help with anything. He just did it. Is some of that generational issues come in, you think, with caregiving, younger caregiving men versus the older?
Well, I think, yes, it is generational, but I think it's also just innate in how we raise men in America, right? We're trying to figure out how men are always out there. So how do I solve a problem? Well, if you start being a caregiver, you recognize there is no solving some of the stuff that comes at you, right? So all of a sudden you realize that, okay, let me take a deep breath. This is like way more than I thought it was. Like and then you got to hear those words, like it's okay to drown. Like I'm drowning. It's okay to be drowning. So I think at least caregiving, from what I've experienced, is so much going on that it humbles you very quickly. And the people that I have seen go through this, it really does. And this is why I say it takes a village, because I think once, no matter what age of a man he's in, when he recognizes that he's not going through this alone, then he learns to open up fairly quickly, because you're drowning. You don't know what to do. You need help.
That's very true. Do we have any questions from our audience out here to Dr. Turner? A comment. Seems that the Veterans Administration could partner with you, Dr. Turner, on this important study. They are right there on Irvin Street. So have you reached out to them?
No, I haven't. I don't have relationships. I haven't made any inroads. Again, I'm out kind of, I'm almost like that, that evangelist on the street corner. I'm willing to talk to whomever I possibly can. And unfortunately, I have a great staff that are young college students that are helping me do this. But if you have direct relationships that I can speak with, I would certainly be willing to do that. I know that there are some issues with, in terms of the veterans allowing you to have access to other veterans, right? So we'd have to work through that. But I think veteran population is a really important population that I really would like to be able to have access to. So if you have a way for me to speak to people, please let me know.
Right. So we have a veterans office in Prince George's County with Dr. Dula, and Shonda Bellamy will make the connection for you.
Okay. Thank you.
You're welcome. There's another question. What is your hypothesis for this study?
Well, my hypothesis for the study has changed, to be quite honest, and that is because I've spent some time with men in the community. One of the most profound things that I did was I went outside of, y'all have probably been to the metro station outside of, in Foggy Bottom, outside of the hospital that we have there at GW. And one of the men said to me, I said, we're trying to understand about stress and about, like, when you're in a stressful situation, how does that affect your cognition? And one of the things he said, listen, I'm gonna tell you straight up. He said, being a Black man in America is stressful, right? And so I said, okay, all right, so let me rethink how I'm thinking about this, because again, we know that if you are, and again, we don't use these words stress, but looking for an example, let me talk about what I mean by stress here. That might be a little bit easier to talk about. So my parents, my mom, she has kidney failure. So she has in-home dialysis. And then my mom was a primary caregiver for my dad, who has dementia, and it's progressing. And so my mom has a real limitation. She needs help with her own care, which means that she's not capable of carrying out and looking after my dad in the same way. And so we have a home health care worker that we had come into the house. All of the siblings, we all live far away. But it's not cost prohibitive for us to be able to continue that. We're not going to be able to do it much longer.
Right.
So all of a sudden we're thinking, all right, how do we get aid? How do we find support? How do we make this thing, affordable? And so I don't even know where to turn. Do we keep them in New Jersey? Do we move them down the DMV area with us there? All of these things. And no matter what you do, the short-term solutions don't give you the long-term solution that you need. That is burdensome, it's stressful. And me and my brothers, when we talk about it, and my sister, we talk about it, sometimes we just sit around and we just say, okay, we don't know what to do next.
Right.
That's the kind of things that we're talking about, right? So we've got to be able to figure out, like, how do you deal with that? Now, is that stress for Black men any different than the stress of when, first hired, first fired, or the police, pulling you over that we have seen, is, not being able to, have the money for rent. Are they the same, or are they different types of stress? So my hypothesis is really kind of changing, but I think it's going to, I think the stress levels are not the same for everybody, but I think it's going to manifest in the way that you function cognitively different for different groups.
Very true. Thank you. There's a comment, Dr. Turner, I would encourage you to reach out to the Black radio stations, particularly the gospel station, to share your message. Many folks in the caregiving group that I lead have indicated that listening to gospel music radio station is part of their respite therapy.
Oh, wow. That's wonderful. That's something I've never thought about, and that's amazing. But I do want to pick up on that last thing. And again, and you can put it in the chat, you can send it in emails. I'm not a native of DMV because I'm from Jersey. I've been in DMV for about 7-8 years now, but like most researchers, I'm in a cocoon sometime. So if you can share with me which radio stations, where to go find them, I'll reach out to them as well. So that's really good. But the last word you used was respite care. And I think for hopefully everyone knows that, but I think that that's one of the things that I found when it comes to caregiving is really lacking, is where can you turn to, especially if your family's not there or other people, where do you get that respite care? Who can walk into the house and give you that 1 or 2 hours that you need? Who allows you as women, who allows you to go get your hair done? Right? Or as men, like to go chop it up in the barbershop. Where does that come from? And that's why we're kind of need to have that collectivity in our community to provide some of that support for one another.
Right. It's like one of those things, you don't know what you don't know, right? So you really don't have the questions to ask because you don't know what's out there. But
I see Sandra's comment in there. Let me say, Sandra, my gospel music I listen to on YouTube, so that's where I get mine from. But I don't know the local radio stations.
Shonda, you said what I was thinking. Another message came through that said frat organizations like the Qs, Kappa, etc. in the community. Oh, right. They may be able to help since they are service organizations and they're all Black men.
Yeah,
So
we're reaching. Yeah, we're reaching out to them. Something again, one of my big issues is that we don't have personal connections in many of them in the DMV. So we reach out through emails, and it's a hit or miss as to whether people are actually responding or not. So again, if you know locals, especially some of the older guys who are serving as mentors to the college students, please let me know.
Certainly, I know as I'm sitting here, I can think of several organizations and individuals here in Prince George's County that I would like to connect you with so that you can continue your study, and we can talk offline about that later.
Thank you. Yeah, that's perfect. Because if I were doing it in New Jersey, I just basically run through all of my family members and everybody else, and I'd be able to get what I'm doing. But not being a native to a place and then having the restrictions of COVID has really, I guess, not allowed me to develop the relationships that I would like to, which is why I'm very grateful for the fact that you've allowed me to be with you.
This has been wonderful. I'm thinking, why didn't we have you here sooner? I mean, this is a lot of good information. So Mr. Lawson said we enlist the women to encourage their men, husbands, sons, father to contact you. And please provide a good email address for the contact in the chat.
All right, I'll do that. And you showed it before on the video, but I'll certainly do that right now. But let me just say, Reginald, that is a spot on statement. One of the things that we know for sure when we talk about men's health, and what I try to stay away from, because it is true. I was on a call the other day with these brothers. They were talking on YouTube, and they were encouraging Black men to look after their health. And one of the things they said was, if you look at almost any metric, anyone on every aspect, diverse population there is, Black men have almost the worst outcome of everything. Right. And so we always talk about Black, like if we just keep focusing on what's bad about us, it's like, where's the hope? But I will say this, and to his point is, believe it or not, the Black men who have the best health outcomes are Black men who are married, believe it or not, right? Or they have a very active, strong woman in their lives and telling them, you need to go to the dentist. You need to go to the doctor. You need to make sure, stop eating this. You need to do those things. So that's why I started off in the very beginning. When we talk about Black men's brain health, Black women play an essential role in Black men's brain health, right? And I won't just say to, because people have all different kinds of partners. So let me just say, men who have partners in their lives tend to have better health outcomes. And so you're right, we want to reach out to them and let them know, hey, get them involved with this study as well.
Now, are you here in Prince George's? Are you based here in Prince George's County?
No, I live in Arlington, and my office is at GW on campus there. So, coming out to PG is not a problem for me.
Okay. I was just asking because one of our politicians is a Q and loves the seniors, and he loves the seniors, and, politicians could help as well.
Absolutely. Just tell me where to go. Tell me where to show up, and I'll be there. Tell me whose door to knock on. I'll do it. I got no problem with that.
And I believe that we're going to give you that information too. What age group does he want to participate in the study?
Great question. Thank you. We're looking for men in this particular study who are 30 years and older. And to that point, let me just mention something. And I just gave you the link for the actual study. I gave you the email link, and I'm going to just give you also the link for my lab, research lab, so you can gain all the information about me and the study participants and all these other things. I'll put it there as well. This is a really important point. So we're looking at individuals 30 and up, but most research in the way that biomedical research is designed, we look at what we call older adults who are 65 years and older, right? But the problem is the life expectancy for Black men is literally now, because of COVID, it's like around 66 years old, right? So we are trying to explain to our funders and everyone that for us, because of the accelerated cognitive aging process, we need to start, and it's very sad, but you start to think about men who may be 55 years old in terms of Black men's health. That might be an older adult Black male profile for us. And we might look at, like, my dad, who's 84, would be a super ager, right? And we need to find out what allows a man to live 84 years old. We need to find out what is, what is really challenges, not in the statistical numbers or anything else, but what are Black men who are going at 55 years old, what's prohibiting them from getting to 85 years old, right? That's the kind of work that can only be done for us by us rolling our sleeves up in the community.
Exactly. Do the men have to be caregivers of persons with dementia in your target group? Or are caregivers of all like special needs included?
That's a great question. For us, it has to be, for this particular, because it's a pilot study, but it has to be, it can be diagnosed or undiagnosed, what we call cognitive impairment, right? So if the person has a memory problem, a functioning problem, or anything else, but we're not, for this study, we're limited. So we're not having people who, let's say, are physical handicaps or anything else like that. It's really, are you looking after someone that has some kind of neurocognitive impairment along the life course?
Very good. Well, we're running up on the hour, so I would just ask you, is there anything else that you would like to tell the group before we close out tonight?
Yeah, I would say this. Even though we're about halfway through collecting for our study, I think that there's plenty of opportunities to work together, to hear from you, and people who are out in the community, to let us know, especially around, again, I do brain health work. So it's all around mental health, brain health, all this other stuff. I want to just say this. The Alzheimer's Association does fund a lot of the things that I do. And I know that they're very committed to looking after Black people's brain health. And the reason that I can say that with all confidence is because the vice president of the diversity, equity, and inclusion is a brother named Carl Hill, who happens to live in PG County. And he's in charge, he has a whole budget in charge of making sure that people in the community know about what the Alzheimer's Association does, but then also keeping Alzheimer's Association on point to do the kind of work that reaches out into our community. So that's one thing. The second thing is the woman, Dr. Maria Carrillo. She's in charge of the research arm of the Alzheimer's Association, and she's a person of color. And she is in charge of the largest budget outside of the NIA to look after Alzheimer's research and cognitive impairment. And so I think, as I said before, and I want to just emphasize it once more, I'd love to work with groups like yours to figure out what are the important questions that need to be asked, and how do we get these funders to fund them so that way we can impact the long-term health of mental health of our communities. So that's what I'm looking for. Most importantly is, yes, I need 40 more men for this study, 35, 40 men. But what I really need is a long-term relationship so we can push those funders to look at some of the issues that are important in our community and to fund those things.
Well said, sir. Well said. Ms. Bellamy, do you have anything to add for tonight? Okay.
She's still focused on the fact that I don't know the local gospel radio station, but I can assure you there's a lot of great gospel music on YouTube and on Spotify.
So we're going to get you some information on organizations here in Prince George's County that you can reach out to, partner with, so that we can make sure that you reach that goal of getting those 80 men that we need.
Thank you so very much. I just really appreciate y'all just, being here and offering this opportunity for me. And I hope that I'm providing you with information that's helpful in your journey.
For me, you have, and I'm sure for those who are out there listening, you've said some things I've never heard before and probably new to a lot of others here. So thank you so much for just making your message plain and clear. I really appreciate that.
All right. Thank you very much.
All right.
Everybody have a great evening.
You
Bye-bye.
too. Bye.